You're listening to the Play Therapy Podcast with Dr. Brenna Hicks, your source for centered and focused play therapy coaching.
Hi, I'm Dr. Brenna Hicks, the Kid Counselor. This is the Play Therapy Podcast where you get a masterclass in child-centered play therapy and practical support and application for your work with children and their families. In today's episode, we are continuing on our Filial discussion, and we're going to talk through the goals of the Filial approach. And obviously, as I mentioned before, my frame of reference for Filial is the child-parent relationship training. So that is Landreth and Bratton's model, and the 10-week curriculum is the only Filial approach that I've ever used. So I just want to make that clear. But I think that universally, Filial has specific outcomes and goals that are intended. So I want to kind of work through those and help you understand what that might look like. Especially if you're going to start offering Filial therapy, specifically CPRT, I would hope you would want to be able to communicate to parents what the goals are and unpack for them what to expect, and from all different avenues, what the outcomes would look like. So we're going to start with parents, because obviously there's going to be goals for the parents, there's going to be goals for the children, and then there's going to be goals for yourself. And if we unpack each of those three components, I think you'll have a pretty good handle on how CPRT would be beneficial to add to your suite of services in your practice. All right. So, related aside, it is Tuesday, the last week of March, and this coming Friday, the 29th, is a Filial training on CPRT specifically. So there are still some seats available. If you are interested in getting CEUs for that, please go to childcenteredtraining.com and you can get signed up for that. All right. So for those of you that are just going to listen to the podcast, let me dive into this. When you're talking to parents and presenting CPRT as an option for them and helping them understand the value of the Filial therapy model, you need to communicate to them what they're going to gain from the process. And just big picture, they are going to gain tools. That's in its simplest form, which I'll give you some more details and specificity in a minute. But when you're talking about the tools that they will gain, every parent needs to feel equipped. They need to feel knowledgeable. They need to have skills and approaches that they know are effective. So the Filial model provides that, because CPRT's curriculum teaches parents to use the same child-centered principles with their children that we use with kids in the playroom. So they are learning the exact same content of our skill set. And the intention is that the parent becomes the person that provides those interactions and those skills to the child. So the tools are invaluable as something that the parents will have. And that is a huge goal, to make sure that they feel equipped and ready to handle any scenario with their kids, because they've been given the skills and the principles that they need. So obviously they're going to acquire knowledge. The goal would be that they learn and they understand and they are able to practically apply the knowledge that they've gained. Another really important goal, which it may not be important to parents at the beginning because it's hard to get them to understand the value of it until they've acquired it, and then they absolutely see the value of it, but a change in the way that they interact with their children. And again, that's a little bit of a hard sell at the beginning, because they don't know that they need that. They don't really know that they want that. They don't see the value in it. But I promise you, once it happens, they are very aware of the impact that the change in their interaction had on their relationship. So they learn different ways to interact. They learn different ways to communicate. And the entire process of their connection and dialogue and back and forth with their kids is transformed when they begin to use the tools and learn the principles. So the interaction shift is a very, very important goal. And that is something that every parent will experience, because they can't help but witness the change that takes place when they begin to interact and talk and communicate differently. And then a final goal for parents is they learn to focus on the relationship. So one of the rules of thumb in CPRT is focus on the donut, not the hole. And that is straight from the beginning, week 1. And the premise there is if you focus on what's wrong, if you focus on what's missing, if you focus on what you wish were different, if you have any focus other than the relationship that's already there, you lose sight of the child. And when parents are able to shift their focus to the relationship that they have with their child, it changes the dynamic, it changes the love, it changes the acceptance, it changes the tone. Everything is different when the parent really focuses and grasps the concept of focusing on the relationship. And far too often, parents just want things fixed. They just want things better. They're frustrated with the state of things. They don't want to be in the position that they are. And so there's this bent toward, I'm unhappy, or I want to become happy. But in either scenario, you lose sight of the child because you've lost sight of the relationship. And the CPRT process actually conditions them and helps them understand why focusing on the relationship makes such an impact. So those are the goals for parents. And then concurrently with what the parents are gaining, the children also are gaining things and have a sense of goals that are achieved through this process. So number 1, first and foremost, they learn to self-regulate. So that's very, very important when you have a family dynamic where mom and dad are really frustrated or intolerant or they want things to get better. Well, it should make them feel very encouraged that you can share with them that one of the goals that kids will achieve is self-regulation. And of course, we know that because that's one of the 4 universal outcomes of play therapy, right? So that's not a surprise to us, but it is often sometimes something that a parent does not feel prepared to receive. They don't know that if they do this parent program that their child will regulate better and self-control. So that's a very important goal for a child. Another component is children behave in more self-enhancing ways. So let's tie this to what we have for goals for parents versus what we have for goals for kids. As parents, focus on the relationship. And as parents, change the way that they interact. And as parents, have new and more effective tools in their parenting tool belt. It allows the child to feel more loved, to feel more accepted, to communicate differently, to feel more heard and understood. And through all of those changes, the child starts to behave in more self-enhancing ways. So you can see how one affects the other. And interestingly enough, as a child starts to behave in more self-enhancing ways, and as a child learns to self-control and self-regulate more effectively, that also changes the relationship and the interaction and everything from the parent side. So it is very much a symbiosis, if you will, where one is impacting the other. And the dynamic is so powerful that as one changes, it causes change in the other and vice versa. So very, very important to recognize that the goals are for individuals participating, right? So there's goals for you as the therapist, there's goals for the child, there's goals for the parent. However, they're not seen in isolation and they can't be seen separate from the other because, as I just explained, the changes are mutually beneficial and they create more change. And then a final goal for the child is they feel validated and heard and understood. You really can't put a measure of significance on a child who has a sense that someone in the world gets it. And especially when it's a parent, that is even more significant because kids can function and make do with anybody in their life that serves as that, hey, I get you, and I unconditionally love and accept you. But if a parent can fill that role, there's a sweetness and a depth to that really can't be replaced by someone else. So as the child realizes, hey, mom really gets it, mom gets me, or dad really understands, dad always tries to see things from my perspective, those are powerful declarations that the child is able to make. And therefore, again, it allows the child to self-control and self-regulate and behave in more self-enhancing ways. So everything begets the next. I liken it to a snowball that starts rolling down a mountain. It just gets bigger and faster as it goes. You really can't stop the momentum once it starts. So we have parent goals, we have child goals, and then what about therapist goals? Well, number one, you serve as a liaison. So essentially, you know how to communicate on a parent's level in a way that a parent will understand. You also know children, you know development, you know age appropriateness, you know the way that a child's brain works, the way that they live in their emotions, you know all of those things. So you can help a parent see a perspective on their child. You can help train a parent to communicate more effectively with their child. And essentially, you basically speak on behalf of the child to the parent, because often the parent really doesn't understand things from a child's point of view. So not only are you giving them tools and skills and knowledge, not only are you helping them understand how it will impact their child, but sometimes you have to communicate on behalf of what's going on for the child. So parents get really upset because child threw a tantrum. It's your job and your role as the facilitator to help them see what was going on, what was the catalyst, what was the root, what was at the heart of the issue. And then you turn them back to the skills that they've acquired and you help them work out how to handle it. So essentially, I guess an easy way to sum that up is you have to be able to speak parent and child. So you have to communicate effectively with parents. You have to help parents understand what their children can't communicate to them. And you kind of you serve as the go-between, if you will, so that they both get a better understanding of each other. And you are going to facilitate their connection. And it's all about the relationship, right? So as you watch play sessions, as you talk about scenarios, as you role play specific frustrations that they have, as you're training the parent with the skill, all of those interactions lead to your facilitation of connection for them. So you point out little subtle improvements. You point out really tender, endearing moments where they look at each other and they smile, or the parent effectively reflects a feeling, or the parent provides a choice that's really appropriate in a moment, or they talk you through how in the past it would have turned into a 45-minute screaming fest, and they were a thermostat, not a thermometer, and they used their new skills, and the child was able to comply with the limit. And you celebrate that with them because you're facilitating connection. You want them, again, they're focusing on the relationship, right? But you want them to feel the power of the connection that they're building and that they're forming with their child. And you serve as the facilitator there. You are helping to bridge the gap between the parent and the child so that those connections and those relationships can develop in the way that they should and in ways that are best for the family dynamic. So I hope that you find that helpful. And just to kind of give you a couple of takeaways as we wrap up, you, above all, I mean, yes, there's goals, right? So we've just dove into those three, but CPRT provides a system and a framework that serves as a foundation for parenting. And you are teaching the system and the framework so that they have a foundation. When parents don't have a foundation, when parents don't have a framework, they are fly by the seat of their pants. Anything goes. Let me just try this random thing and see what happens. And it's a hodgepodge parenting approach, and it's ineffective and it frustrates everybody. So CPRT is a framework, it's a system, it serves as the grounding and the foundation so that parents have something upon which they can fall back on. Now, you have to keep in mind that they're not always going to get it right, but the goal is they at least know, okay, these are the principles that I need to be aware of. These are the things I need to consider. These are the pillars that I need to be using. These are the approaches that are the most effective, because then they are prepared and they feel confident. That's huge. And secondly, they gain a better and more thorough and deeper awareness and philosophical understanding of kids. Let me make sense of that really quickly. Parents don't see kids as little beings often. They don't see them as feeling beings. They don't see them as emotional beings. They don't understand that their feelings matter. They don't understand that they are just little versions of us. And while they don't possess the cognitive and the logical and the intellectual capacities that we do, they have all of the emotions that we do. And when parents just discard them or get frustrated with them or see them as a problem behavior or, have very little tolerance for whatever's going on, it not only fractures the relationship, but they don't really understand their kids. So CPRT and its tenets and its principles and everything that you teach, it actually gives them a deeper and better understanding philosophically of their children. And that allows them to focus on the relationship, and it allows them to change the way that they interact. It allows them to use their new tools. So those are the two big principles that guide all of CPRT, the system and the framework, and giving adults a better way to understand and process what's going on with their kids. And then, yes, the goals are important, but you kind of swirl all that together, and that is the rationale for providing CPRT and filial therapy to your families. So hope that was helpful. I hope that it inspires you to maybe consider doing filial. And as we talk through this in future weeks, maybe you'll start feeling more confident that you could add this into your work with families and kids. And I think you'll find it very, very rich. I've loved doing CPRT. I've been doing it for almost 20 years. And I really, truly find it very fulfilling and rewarding. So hopefully you'll feel that way as well once you dive in a little bit deeper. As always, I would love to hear from you, Brenna at thekidcounselor.com. If you want to reach out, that would be something that I very much enjoy. I love getting emails from you all. And playtherapynow.com is your hub for all things child-centered. So if you want info about the newsletter, the collective, my trainings, any of that stuff, please go to playtherapynow.com. We'll talk again soon. I love you all. Bye.
Thank you for listening to the Play Therapy Podcast with Dr. Brenna Hicks. For more episodes and resources, please go to www.playtherapypodcast.com.